Hello, my name's Daniel Helm. I'm from Pompano Beach, Florida. I'm 58 years old, and I started losing my hair, thinning at about 32, and progressively getting worse. And I'm not considering retiring, and I just didn't like looking at myself anymore. I am an orthopedic medical designer and distributor of implants. So I've been in the medical field for now 24 years, and mostly orthopedics and so forth. The hair loss in my family is my father and three out of four of my brothers. No, I have not had any prior procedures. Realistically, I've been looking for hair transplant restoration for probably approximately 8 years. And looking at the different techniques that were going on, and I waited because some of newer techniques were coming out, some robotics were coming out, so I wanted to see where all that was going. And I wasn't that bad my hair loss wasn't that bad up until about 5 years ago. What I want to accomplish today is a fuller, better looking, younger, youthful look, so I can still conduct business, because right now there's a lot of young guys out there that I'm competing with. My hair loss, it's affected me in the last 3 years. Really started affecting me that I just didn't like looking at myself in the mirror anymore. And I was very self-conscious, going into a client, going into surgery with some of the surgeons, and the wind would hit it. Next thing you know, it's like I'm walking in, it's sticking up in the air, and I'm always going into the bathroom, trying to fix things, and hairspray. I don't like hairspray. And I find myself gluing my hair down, which is not good. It can't be good for you. So, and that's where self-esteem and the look is, I chose Dr. Huebner National Transplants after months and months and months of research and visits to other facilities, other doctors, different techniques, and because I have a little bit, of medical knowledge and so forth, I've come to the conclusion that the single hair transplants, like some of the competitors, like NeoGraft, and I'm going to say it, and NeoGraft and the Artist Machine, is not going to work for me, because I need more hair transplanted. And they're going to take all of my donor, and I'm going to need that, and that's why Dr. Huebner is technique, and he takes more hair at one time, so we can get a fuller procedure in one sitting versus multiple times coming back, because everybody else wanted to do 2,000, 2,500. I mean, realistically, that's not enough. I'm going to have to patch your hair, I'm going to have to come back and do more. I'm not saying I don't have to come back, we might have to, but it's going to be for a lot less than what I'm going to do today.
So I'm here with my patient today, Daniel, and we're now talking about what we want to do. And we're talking about, obviously for him, he's lost his hairline in the front, so we want to put that back together. So we're going to discuss how far down we want it. We don't want to put on an 18-year-old hairline on someone that's over 50 years old.
Hey.
So, hey. Sorry, 40 years old. Sorry. So we're gonna talk about that. We're gonna draw it out and talk about the priorities and what's gonna happen today. Okay, Dr. Huebner here with Daniel. We're about, I don't know, maybe a third of the way through the surgery. At this point, we've removed the strip from the back, and we're actually able to get an additional strip. So not only the 30 centimeters, but he had the elasticity to even get another strip. So we really try to maximize the amount of hair we can get for every patient, and that's going to show in his results. But at this stage, the strip's been removed. I'm about halfway through sewing him up, and I just wanted to kind of check base with Daniel. Daniel, how's your day been so far?
So far, the day's been really good. We got anesthetized, a couple of needles. You feel those for maybe 5 or 6 of them, and other than that, I'm sitting there and I'm eating Cheetos. And we got Smarties, but no, everything's been doing very, very well.
Yeah, we had to call the Smartie supply company. We've gone through about 2 million packs of Smarties today.
Yes.
But we've learned that we like them very much. But I want to kick you around here, and I can show you the incision. So this is Daniel's suture line. We're about halfway about halfway done sewing him up. But this is what a suture line should look like. So this little tiny line here is where the edges are completely together. So that's the size of the scar. It's like if you took a pencil or pen and just drew a little light line. He's got some oozing, and that's to be expected after surgery, but that, you know. But it comes right around. You can see how exactly approximated it is. There's very low amount of tension, the perfect amount of tension on this suture line. That's the key to having a great result. We use a continuous stitch. We never use staples. I've seen some horrible results with staples. But the tension is really key. Experience is key to getting this perfect. So after he comes back in 10 days, we'll show you exactly what this looks like. But I wanted to show you now, as we're suturing it, what it should look like. Very excited to see Daniel's results. He's going to look like a new man. Dr. Huebner here, Natural Transplants. We're here with Daniel again. We're about 2/3 of the way through the surgery at this point in the procedure. I don't even call it an operation because it's such a superficial, easy thing to go through. But for the procedure, we've cut out the strip in the back. We've sewed it all together. Perfect little suture line in the back. We'll show you later. And now we've made all the little tiny paper-thin slices, little sites where the grafts are going to go in. And all now that's going to happen is the team's going to come by and put the little tiny grafts right into those little slots. Those little slices, those slots, make the angle of the hair, which is so important. You don't want the hair to stick straight up, look like a chia pet. So we want the hair actually to stick forward. It's going to shoot forward, and then depending on how he wants to style it, that's up to him. So you can style your hair any way you want to after the procedure. Daniel, how's the day been going so far?
I just woke up.
Just woke up.
Okay, so it's going very, very well.
That's how uncomfortable it is.
Yeah.
And we've been watching some movies, again, eating a lot of Smarties and chips. And we'll probably have to get some liposuction afterwards because of all the candy we're eating. But it's going to be a nice change for him. Okay, so I just wanted to show, a lot of our viewers are asking what it looks like after we make the slits. And so I want to zoom in here and show you. So this is basically the amount of coverage we have. Now, Daniel really didn't have much hair in this entire area. Maybe, you know, we shaved away maybe 10 hairs in the front here. So again, to get your entire head with lush full hair usually doesn't happen unless somebody has amazing elasticity. But even the amount of hair that we got, we created a little hairline in the front here. So all these little tiny slits are 1 and 2 hair grafts. These are the very tiny ones that will see this hairline. It's always nice and staggered, so we never put a straight line. These are always nice and staggered, up and down, to create that natural hairline that he needs. Behind that, we transition it into these bigger grafts. So these little slats back here are actually a little bit larger than the ones in the front. And that will allow us to place a graft which has 4, sometimes 5, 6 hairs in each one of those grafts. So basically you can see the coverage we have. What we're doing here is we're allowing it to set up to our natural crown. So now he's going to have his hairline back. He's going to have all this hair in the center portion. He's going to be able to style his hair any way he wants. He may even get coverage in that crown because if he grows his hair out and styles it back, that's going to allow him to get additional coverage in the crown area. If he ever wanted another procedure, we would probably strategize it in a way where we would put coverage into the crown, maybe half of the grafts, and cover that crown, and then run the other 50% through the initial area that we already did. With any procedure, the way that we do it, you can generally recreate about 30 to 40% of your natural density that you have in the back from one procedure. To get more than that, you would need another pass in the same area. Now, Daniel going from 0 hair, getting 30 to 40% is going to make such a huge difference. A lot of our patients are even satisfied with 30 or 40%. They don't want any more or need any more. But he has plenty of donor here to do exactly what he wants to do as far as a density standpoint. Can't wait to see his results. Please call us if you have any questions about the process, the procedure. All of our patients, as you can see, are very, very comfortable, happy. They fall asleep a lot of times in the procedure. They come back and they're very happy to show the results and talk about the results. So please give us a call, naturaltransplants.com.